See, the main reason I want to come down to Florida is I like those introductions, you know? Anyway, it's great to be here with you. Essentially, most of us know each other at this point from coming down here for many years and having the opportunity to share our science with you and our insights with you and get your questions and concerns. It's instructive for all of us and mutually productive. And again, thank you all for being here, for participating in this wonderful fundraising event. As Myra mentioned, the foundation has raised over $300 million, and I'm the guy who spent over $300 million for doing all good things. And one of the interesting things is, you do things for years and years and years, and you think you really understand it. And then all of a sudden you get an insight out of nowhere that comes, and I had one sitting at the table, which really sort of shocked me. And that is, this is the third kind of gathering in the last few weeks that I've been at, and the other three were real heavy science meetings. I mean, just discussion about science. And with the introduction of this meeting, we were talking about issues of relevance to individuals, patients, people who are trying to avoid being patients, people who are trying to help people who are patients, and questions about medicine as opposed to questions about science. And I realized what really makes this organization special is the fact that we can choose among our experts to have them come here and sit here with you who are truly experts in patient-related issues, health-related issues, and at the same time who are experts in scientific issues. And it's very hard for me to think of other organizations that could randomly choose, close your eyes and just grab somebody and know that not only could they talk about a high level of scientific inquiry, but at the same time can talk about a real honest-to-God, down-to-earth, day-to-day medical issues. And that's really, Edith, who I'm introducing in a second, is shaking her head. And that's really a very, very special thing. Yes, you're going to ask us questions, and we're going to talk about issues related to cancer medicine, without doubt, and cancer prevention and everything else that we're interested in. But we're also going to talk about science. And that is something very important to keep in mind. Science is what cures cancer. We can provide the very best care in the world right now with what we currently have and cure most people with breast cancer, but we're not curing everybody. We can prevent a lot of breast cancer, but we're not preventing all of it. And in fact, as everybody in this room knows somebody who's been touched with this disease. And so it is imperative that we advance our scientific understanding. And it's not just going to come from really high-quality medical care, which is what we're all about, but it's going to come from high-quality science, which is what we're all about. And what we're really all about is doing both those things exactly at the same time. So I have the great pleasure of introducing the panel. You're all supposed to have been up here already. Come on. Come on, team. And in the order in which we decided that everybody is going to speak, Edith Perez, who's from Mayo Clinic, but in Jacksonville, Florida, is joining us. All right. And then next to her would be, I guess, Tan Inche from University of Miami. Then Nadine Tong from Beth Israel Deaconess, Harvard Medical School. I got them both in, Nadine. And then Clifford Hudis, who is from Memorial Sloan Kettering Cancer Center in New York, an institution very near and dear to my heart, and is the chair of the Scientific Advisory Board for the Breast Cancer Research Foundation, whose job it is to seek out the very best scientists, physician scientists, people who could really make a difference and bring them into our family where they can do their work and also work all together. And I'm going to ask them, before I sit down and join them, to spend a few minutes, starting with Edith, talking about what work they are all doing that is being supported by BCRF and is particularly exciting and you should know about. And then we're going to open it up to questions, and so we can all have a nice discussion together. So Edith, take it away.